My name is Oyin Penny. I'm a nurse practitioner with Premier Gastroenterology. Welcome to my MASLD Community Network. Here are some frequent questions that primary care providers ask regarding patients with MASLD. And one of the common questions is, when do you screen a patient for MASH? And I often tell people that screening should start when you notice that your patient has two of the risk factors for metabolic syndromes. So that would be obesity, prediabetes, hypertension, hyperlipidemia. Those are some of those risk factors. If they have steatosis on imaging, those patients should be screened regardless of what their liver enzymes are, or if they have elevated ALT. Another question is, when do I refer my patient to a specialist? You refer your patient to a specialist if you, for instance, get a FIB-4 on your patient that is probably indeterminate or intermediate, or if those patients have a high risk for advanced fibrosis. Low risk patients could probably be monitored with a different NIT maybe 2 to 3 years later on a FIB-4. However, I would say generally, if a primary care provider just does not feel comfortable managing a patient that has MASH, refer them to GI or hepatology. It's just better for the patient to be managed by someone who feels comfortable managing them than to wait and the patient develops advanced fibrosis. And lastly, how do you monitor the progression of MASH? Progression of MASH is typically monitored by the use of NITs, which we have several of them. We have the FibroScan, which is the most common one. We have MR elastography, and we have ELF tests. So those are tests that could be utilized. But like I said earlier, instead of a primary care provider managing these patients with already diagnosed MASH, they should be referred to a specialist. Thank you so much for joining me. And please look forward to seeing future videos on my network. Thank you.